Hello, everyone. Thank you for taking the time to join us for today's webinar. So this is actually one of our first Oscar Pro webinars and specifically for the Ontario audience. So super excited to have you all on here with us today for our webinar that we're titling From Online Booking to eReferrals, How Ocean is Helping Oscar Clinics Embrace Digital Tools for Better Care. So to start off with some introductions, my name is Melissa, and I'm the partnership manager here at Cognizant MD. Also on the line with me is our senior manager of business development, Samantha Fitzsimons. She heads up our sales team, so some of you may already be familiar with her through various demos or conversations, and I do recognize some of the names in the side as well. So again, thank you for kind of sticking around and learning more about Ocean with us today. So I'll quickly just walk us through some of our housekeeping items, and then I'll pass it back on to Sam for today's presentation. So if you haven't already noticed, we will be muted throughout the webinar. We will have a Q&A session at the end, so we'll give you the opportunity to unmute if you want to ask your questions out loud. But I would say the best method is if you do have any questions throughout the presentation, please just toss them into either the chat or the Q&A box, whatever your preference is. I'll do my best to just answer the questions throughout, just so I don't interrupt Sam while she's going through things. But if there's a question I think can wait until the end, maybe kind of it would benefit if everybody kind of heard it, then I may just save that for that purpose. So as well, the presentation is being recorded. So if you have any colleagues or other physicians who may have missed this and you want to share this with them afterwards, it will be available for you to do so. So with that, I will pass it back over to you, Sam.
Perfect. Okay, so I'm really excited to be here today. As Mel mentioned, I'm going to walk you through the Ocean platform, and I'll highlight some of our products and have some quick demos of the various products. We'd love to have a conversation today about how we see Ocean impacting your practice, and it can do that in a couple different areas. And as Mel mentioned, would love to have a discussion afterwards about any particular questions you guys have or anything in particular you want to dive a little bit deeper into. So hope it's helpful for everyone. So I thought I'd start with just a little bit of a background about who Ocean and who Cognizant MD is. Ocean is a secure, clinically focused platform. So Ocean is the platform, Cognizant MD is the company. Some people get confused by those two names. Cognizant was founded in 2013 by Dr. Doug Kavanaugh and his brother Jeff. And it was really kind of born out of experiences that Doug had in his own practice and his frustration around having patients fill out forms on paper and then kind of what you do with that. So he created a solution that at the time a patient could fill out a form electronically on a tablet and have that information automatically uploaded into his EMR. And so I always like to share that because our solution over the years has grown and changed and morphed into all of these different kind of products, but that e-form engine, that ability to have patients answer questions and have that uploaded into the chart really has remained foundational to all of our other products as we've developed more products over the last 9 years. And I think it's what makes a lot of our products special or different from some of the other ones on the market. So as I go through today, I'll kind of highlight where that e-form completion functionality comes into play with some of our different products and the power that exists with that tool. Talking about today, where we are today, we're up to now over 8,000 physicians using the technology across the country. 800,000 patients currently engage with Ocean every day. And now 1 million patient surveys and studies have been completed using Ocean. Our newest product, online appointment booking, which we'll chat about today, is up to 40,000 appointments booked monthly. 250,000 patient messages are sent a month, and 35,000 e-referrals and e-consults are sent monthly as well. So we're really seeing some nice growth across all of our product areas. So talking about those different products and those different solutions that we have available, which I'll again highlight throughout the presentation. Our solutions fall into kind of two larger buckets. So the first is patient engagement, so tools that better can connect a provider to their patients. And then our other bucket of solutions is what we call our network solutions, or our solutions that better connect providers to other providers and kind of strengthen the system as a whole. So touching first on our patient engagement tools, as I mentioned, one of those in our newest product that we'll chat about today is our online appointment booking tool. We also have patient messaging and appointment reminder functionality, so give you the ability to message a patient either in a one-time way and or automate that as an appointment reminder. And in that message, you can include obviously any information you'd like to provide, any documents, things like that, as well as, again, those e-forms. So any forms that you'd like a patient to fill out and send back to you and have that information automatically uploaded into the chart. And in that product, we also have the ability to send cohort messages, so send messages to groups of patients. We also have a product called a website form, which we'll chat about today. And really that's a way to allow for patients to send back documents or pictures or things like that to you, as well as a way you can use it as a workflow to have patients be able to reach out to their to initiate a communication to their doctor in a somewhat controlled way. And then where we started, which we'll chat about a little bit today, is with kiosks and tablets. And it's interesting now, as I think clinics are starting to open up again to more in-person visits, we're actually seeing more and more interest in those products. So we'll touch on those today. And then the last product that I'll highlight in that patient engagement bucket is our studies and surveys functionality. So we have a solution that allows for you to, again, send out surveys or questionnaires to patients and have that kind of data collected into a usable format for research studies, all of that kind of good stuff, evaluation, things like that. On the network solution side of things, so better connecting providers to providers, the main solution there that we'll touch on briefly today is the Ocean eReferral network. And so that is something that probably lots of you already know about or already getting involved in. And so the Ocean eReferral network is the Ontario government selected and funded e-referral solution. And because of that, there's a dedicated team through e-services that's supporting that rollout and that implementation, which is really exciting to see. So in terms of what we'll highlight today, in terms of the impact that Ocean can have on your practice, we see us supporting in three kind of key areas. The first is around the patient experience. So a lot of tools that can enhance that patient experience and improve their perception of the quality of care. The next bucket is the provider experience. So giving you as a clinician some really important and robust information to make your job easier and be able to kind of focus in your time on where you can be most impactful. So taking away some of the administrative headaches that you may deal with throughout the day. And the other big area, and sometimes where I get, I think, the most excited, is kind of the administrative clinic operational experience. And a lot of the tasks that are in that area can really dramatically save time for the clinic, and again, be able to redirect time more meaningfully to better support patients and their experience. So as I chat throughout our presentation, I'll kind of touch on some examples and some stories that I've been hearing recently that kind of support that and can help kind of hopefully give examples of how we can contribute to the overall experience of everybody involved in care. And so the three kind of areas that we're seeing a lot of activity in, particularly Ontario right now, are one, obviously, as I mentioned, the e-referral network and the expansion of that work. The second is around virtual visits and this like rapid uptake that has been required in terms of providers being now able to support virtual care. And the third is online appointment booking. And obviously there's a funding call out right now through Ontario Health for funding of online appointment booking. And we've seen a ton of activity in that space. So I'll make sure to kind of touch on those three areas as I'm chatting today as well. So on the e-referral front, we didn't want to spend a ton of time here because I think that there's already a lot of conversation going on and a lot of people that are already connected. But just to kind of at a high level touch on Ocean e-referrals, What that is a centralized directory of specialist listings that's integrated in the EMR and accessible to referring providers. And again, that platform or that network was selected as the Ontario government funded solution. I always laugh. So the solution itself is funded to get on the network, and there's also a support team through eServices that is working across the province currently to basically get people set up on the network. That team is larger than our whole company, which I think is so cool, and supports the obviously focus and excitement of the province in expanding this initiative and moving to this e-referral versus faxed referral model of providing care. The impacts have been multiple. One of the main ones is they're seeing a dramatic improvement in terms of the quality of the referrals. And why that is you as a specialist would get to set exactly the information that you need to be able to make a decision about a patient, and can include screening questions and things like that. So the referrals that specialists are getting through the network are much higher quality, and there's less kind of back and forth to kind of get you to the right place. And providers themselves, or referring providers, aren't sending out like a million forms into the ether because they're not sure where it'll stick or what information is needed. The other huge thing that we're hearing is about the improved communication. So both the referring physician and the patient are kept in the loop in a way that through faxed referrals just isn't possible. So we're seeing some really positive outcomes as that initiative spreads across the province. And we'll just say that if you aren't already connected to the network or aren't already in the setup process, we'd recommend reaching out to the eServices team. And I think Mel will send some information after with the link of where to go to do that. And happy to answer any questions as well if there's any questions about the network right now. So we'll dive into, on the patient engagement side of things, some demos, some examples of our products. We think, again, because the eReferral network is expanding and many of you have this toolbar already, we wanted to highlight all the different kind of functionalities that are available for you since you're already using Ocean for eReferral. So we thought we'd start with our newest solution, which is our online appointment booking solution. So we've had an online appointment booking solution for several other EMRs for a couple of years now, and we've taken all of those great learnings and applied it to our Oscar Pro solution. And just to, I suppose, officially announce, we already have kind of our early access group of Oscar Pro users using online booking, and we're expanding that to be available to everyone in Ontario this coming month. So if you are interested, definitely feel free to reach out and we can support you with those setup steps. And if you're part of the Ontario Health funding opportunity and you're on Oscar Pro, Ocean is definitely an available solution through that funding opportunity. I know there's some tight deadlines by March 31st. So we're well aware and able to support all of that good stuff. Talking broadly about our online appointment booking solution, one of the things that I think is really, again, kind of special about the solution is our online booking functionality was built as an add-on to our patient messaging and reminder solution. So what that means is, with kind of what you might think of as the core competencies of an online appointment booking solution, you also get access to the ability to message patients, those automated appointment reminders, and that e-form completion, again, built into the solution as a whole. And that's available for, obviously, patients that have booked online, as well as really any patient in your roster. So there's some really nice value there and some functionality that maybe you might not get in some of the other online appointment booking solutions. So with that, I'm going to walk you through a very quick demo to kind of see the solution in action. Okay. So we're going to start here on basically the login page, and I'll highlight a couple of things that make the solution a little bit different maybe than some of the others. First, I'll just say this is just a URL. So, and it's a mobile and web friendly link. you can really do kind of whatever you want with that link. The obvious use case is obviously having like a button on your website that says click here to book. But a website is not a mandatory thing that you need to be able to use online booking. That's a question that we get sometimes. So you could also email out that link to patients directly, and you could use Ocean to do that. I've even seen clinics that will like use Bitly, like a link shortener, and put it on paper-based collateral and hand it out in the clinic and things like that. So if you don't have a website, online booking is definitely still an option for you. The other thing I'll highlight, and I, again, can't help but make fun of myself when I do these presentations. I think that I will say customize like a million times throughout the span of the next half hour. But one of the things that makes, I think, Ocean quite special in the online appointment booking space, as well as across our solutions, is that level of customizability. So where you see that here is the ability to customize the information that you see there, logos, things like that. So it feels to a patient like they're booking in with the clinic itself versus through like a secondary booking system. So you really have the ability to kind of control the look and feel of the experience. And then the last thing I'll highlight is the way in which someone logs in. So one of the things that's a little bit different about Ocean from some of the other solutions on the market is we don't require an account setup. So there's no initial account creation with passwords or anything like that. That was a choice to basically try to make it as easy as for patients as possible to use, to really lower that barrier to entry, and yeah, make it as usable as possible. The other thing I'll just highlight here is some people ask questions about if you're supporting booking for multiple people in your family. I can't help but think of my own. I have 2 small children, so like in the peak of booking COVID vaccines, trying to remember all the different logins for the 3 of us drove me crazy. So in this scenario, I would be able to log in for myself and or one of my kids and just put that information in there, and I wouldn't be managing multiple accounts or anything like that. So instead of an account, our solution is going to ask for name, health card, and birth date. What it does once I enter in that information is look me up in the EMR. And from that, it's going to give me a customized set of choices. And just to say as well, there's workflows to support non-registered patients if you want to support that in your clinic. But so yeah, so the information is provided and it pulls me up in the EMR. And from that, and this all happens in live time, from that, it gives me options in terms of what I'm able to book in for. So this is one of the things that I think is really cool about our solution for clinicians that are understandably a little bit nervous about opening up their schedules to online booking. You have a ton of control about what providers a patient can book into and what types of appointments a patient can book into, and that can be customized for different patients. So the kind of easiest example is if you wanted to make rules based on primary providers. So you could say that a patient can only book in and only see the schedule of their primary provider, or there might be shared schedules that you want everyone to see. So a good example there is like a COVID vaccine clinic or something like that, that you want to be available to everybody, that can show up for anyone that logs on. So in this example, I, as Martha Gibbs, can see my primary care physician there. So I'm going to select my doctor to book in with, and then somebody else that might log in might have a different kind of list of choices based on the rules that you guys get to decide. The next place that you get some choices and some customization opportunities is the types of appointments that you want to be able to, for patients to book in for. And again, this can be different for different doctors if different doctors want to have different types of appointments that they offer to their patients. So a ton of control there. And you can tweak this. You can add and take away as you kind of build comfort. Some doctors will start with just a couple of choices and then start to add more as they start to feel more comfortable. And you can set rules for each of these appointments as well. So an example is like a doctor might want to have all of their virtual visits in the morning and their in-person visits in the afternoon. You could absolutely set up so that if somebody picks virtual visits, they would be given kind of a set of choices that are different than a different appointment type. The other thing that's cool here is we've just included a very short form. This, again, is just one of our e-forms here asking a question. You can get as fancy or not fancy as you want here in terms of how many questions you want to ask a patient before giving them the opportunity to book. And that can include kind of screening questions to direct them about even if they should be booking online, or if maybe you'd rather they call the clinic or like go to the emergency department or something like that, depending on how they answer certain questions. So again, gives you some nice control about building confidence that a patient is booking appropriately and where they should be. So in this case, we're going to pick a virtual visit, and I'll provide some information here about what I'm asking for. And then based on that, it's going to give me some choices about when I can book. And what I'll highlight here is, again, one of the things that's a little bit different about how Ocean works is we are directly integrated with an EMR schedule. So what that means is, versus some solutions, you have to you have your EMR schedule and you may put in information about availability for online booking in like a portal or a separate area. This is pulling directly from the EMR. Why that's valuable for you guys is, one, it's less work, so you're not managing your schedule in multiple places. And it's also really good for minimizing error. So if you think of like a doctor deciding to block off their schedule for a day next week, if they blocked it off in the EMR, that would be automatically reflected in the online appointment booking schedule in real time. So you don't have to worry about, again, error or patients booking inappropriately. The other thing is, again, that live time nature. So if somebody in the clinic was booking while I was sitting on this page and they took a time that I was going to pick, it literally, again, in live time wouldn't let me pick that choice. So you don't have to worry about any sort of double booking or anything like that. So I'm going to pick an appointment time here. And then it'll send a confirmation to the email listed there, and you get to, that's pulled from what's in the chart, but you can adjust it if there's a different contact contact you'd like to provide. And then it gets to the confirmation page, which again can be different information here based on the type of appointment that you booked and the provider that you're booking with. So again, a ton of customization available there. And you can download the appointment. And the last thing I'll highlight here is you can add post-booking questionnaires too. So in terms of kind of getting the most bang for your buck from each of these patient engagements, you can ask any questions that might be beneficial to support either the appointment or generally speaking. So like a popular example is you could add a demographic screen in there to confirm the information that you have on file in terms of demographics. Or if a patient is booking a new assessment or a first-time assessment, you could have an intake screen or something like that as well. And you get to decide that, and that can be different for different appointment types. So we're just going to confirm here, and then we'll show kind of the other side of things of what that confirmation looks like. So here, again, we just have a short form that provides a little bit more detail, but you can get as, again, fancy as you want here in terms of how many other questions you'd like to ask, and download it to however a patient would like to download the information. And again, that's added to the schedule in real time. So now we see what it looks like on the other side of things. It provides any of that information that was provided. It also notes that it was booked online. And again, any of that information that you might have asked would have also been added to the chart. So the doctor has some useful information to prepare for their visit. And then this is just what the confirmation will look like. So on the patient side of things, they get that confirmation through email, and they have the ability to cancel or reschedule that appointment from the link. And so what I didn't highlight here, and what I'll highlight next, is the ability to combine online booking with appointment reminders, which again is a very powerful tool to improve care. So with that, we'll move on to appointment reminders. And again, as I mentioned, appointment reminders are available obviously for online appointments, but are available for any patient that you might have in your schedule, and a ton of really great opportunity here to automate some tasks that right now your admin teams and your clinics might be spending a lot of time doing. And again, getting as much information as possible from that engagement. So our appointment reminders have, again, kind of the standard functionality that you might think of from a usual appointment reminder, and layered on that have the ability for that form completion piece of things as well. And so my favorite, again, anyone who's talked to me recently, this is like my favorite example, but I think it's such a good example of where you can save time. A couple of doctors that I've spoken to recently about the solution talk about their admin teams, I think, have been spending now, again, as more and more patients are coming back into the office, spend like massive chunks of their day calling patients to confirm their appointments and to do that, to talk through that COVID screen, which I can only imagine is so tedious to repeat that however many times a day. So that's a great example of something that can be completely automated by an appointment reminder and layering in that form to save a ton of time for those that admin team to kind of dedicate to supporting patients in more meaningful ways. And so with that, I'll show kind of an example of the ways in which first you can customize. So we're going to show you kind of the back end to start of how you can customize various appointment reminders. And again, just to say, for appointment reminders, you get complete control over the timing in which an appointment reminder can go out, and that can be different for different types of appointments. And it can also, the frequency can be different. So there might be some appointments that you want to send out multiple appointment reminders, and that's great. You could even send out, you could automate a post-visit follow-up with any sort of information that you might like as well. So you get to set the timing, you get to set the mode of communication. So it can be email, or email plus text message is an option as well. You can enable or disable that confirmation step, so having the patient actually confirm the appointment. And again, you get to customize the message that goes with it, so any information you'd like to provide ahead of time, as well as any forms you'd like them to complete, again, which can be different for different types of appointments. So yeah, my COVID screen favorite example is there for this one, but you get to decide. And so that could include things like a mental health visit might have PHQ-9 or other mental health metrics that you'd like to measure. A new intake might include like initial demographics, anything like that. So a ton of control there about what you want to have patients fill out ahead of time to make that engagement as meaningful as possible. And then this is just a summary of basically the rule that you've created to confirm what it looks like. And this is an example on the patient side of what that looks like. So again, you would be logging in and confirming, and then my patient is going to do a COVID screen as part of that appointment reminder. And then, so it's done on their side, and we'll just show what that looks like. Once a patient has confirmed their appointment, it changes color, and you get, it gets an indication there. And you can also review that information in their chart, any of the information that you would have provided. So again, to use that COVID example as an example of where this might come into play, instead of an admin having to call everybody on the schedule, they could scan the list and basically only follow up with maybe those that haven't confirmed their appointment through this email or text, or follow up with those that may have screened like positive on the COVID screen, or to answer any questions that might have been provided. And then again, the provider would have all of this really useful information ahead of the appointment to make that appointment as meaningful as possible, which is, again, a really powerful tool. So talking more broadly about virtual care and how Ocean might be able to support virtual care, it's been really interesting over the last couple of years to see this like dramatic kind of push into the world of virtual care that providers have been kind of coaxed into through COVID. And what we're hearing from providers often is like, they don't necessarily need a really fancy virtual care solution. Often the phone is great and serves their purpose, but there's ways in which a tool could support to give them the information they need to make that phone call as effective as possible, and to communicate with their patient to kind of set them up for success with that virtual engagement, to be sure that they're providing the best possible care. So we've seen some nice use cases about how Ocean has been used to support that for providers. So I'll walk you through an example of sending a communication to a patient using our messaging functionality to, again, support a virtual engagement. So this is our messaging template or our messaging pane. So you get to access it from the chart. So if you know you're connecting with a patient and you'd like to ask for some information from them, you would be able to access that from the chart. And then you get to, again, decide the message that's here. There's a pane here that's basically seen in the body of the email. And then there's this secure message space that's secure. So you have to log in to be able to access it. So any patient information, that would be where you put that. You have the ability to add attachments, documents, anything like that. And then again, the ability to attach any e-forms that you'd like a patient to fill out. You also have the ability, just to highlight, you can allow a one-time reply if you'd like, or you cannot do that if you don't want to, which some providers feel very strongly that they don't want their patients to be able to message them just in like a free form email. Other than obviously any forms that you provide them. And you can also have a notification when they viewed it or not, if you don't want that extra information. You also get to decide basically the level of screening questions that you ask to be able to log in. So it can be just the birth date, or you can add extra layers as well. So we're going to see what that looks like again on the patient side of things. So here's the message that they've been sent, and they're going to ask just for their birth date here. And then this would be when you would be able to review any messages or information. And in this example, what we've done is actually combined two of our solutions. So our patient messaging solution. And then, as I mentioned at the beginning, we have something called a website form. And the website form can be used in a couple of ways. It can be used as a way for patients to be able to initiate communication in a somewhat controlled way. So that can look, again, like a button on your website that a patient can click on to say, like, contact your doctor, and it can provide an opportunity to send a message and include attachments or pictures or anything like that. And then it basically gets sent to essentially like a controlled inbox that then an admin can manage and kind of direct to the correct doctor. The other thing it can be used for is combined with patient messaging. If you want to give a patient the ability to send back, again, a document, the most popular use case I would say is like a picture. So if a patient has a rash or a birthmark or something, and you'd like to be able to have them send you back a picture, so you have that information, you could do that using a website form incorporated into a message. So we're going to send back a blood pressure reading, and the doctor would then have that information available to them to review ahead of the appointment to make that phone call or whatever it might be as effective as possible. And so we saw obviously this use case in terms of virtual care being through a one-time message, which you can do whenever you want. And again, you could use an appointment reminder functionality to automate that. If, like, for every mental health visit you wanted to automate a PHQ-9 to go out before that visit, you could do that as well. So can be like one-time customized use, or can be automated depending on how you're booking your appointments and your patients. So the last kind of product that we thought we'd kind of touch on before we open it up to questions, it's funny, this is kind of where we started, and we're seeing a ton of increased uptake of these solutions now as, again, patients start to come back into the clinic in larger numbers. So tablets and kiosks basically give you the functionality to have patients either check in or fill out forms or things like that on a tablet, and again, have that information uploaded into the chart. And they can be used nicely on their own to have patients fill out information like that, or you can also use them in combination with the patient messaging and reminders products. So, like, a good example is always, if a patient was sent a form to fill out beforehand and they maybe didn't get around to filling it out while they're waiting at the front, you have the option to kind of give them the tablet to fill out whatever forms they might not have done. Again, my examples are always my own as a patient, but like my two young kids, my doctor would always have me fill out like the well baby screens while you're sitting in the clinic waiting to see the doctor. And that can be done either sent out beforehand and or in the clinic itself, depending on if the patient maybe has gotten around to it. And obviously a really helpful tool in terms of helping to kind of maintain physical distancing. And if there isn't front desk coverage at all times, it allows a check-in option or an option to kind of support patients if there's not a physical body there at all times. So I'll just, as my kind of last quick little demo, I'll walk you through what that might look like. We're starting here from, again, in the chart, and we're going to pull up a patient. In this case, we're going to queue up some forms for them in live time. So that might come about if a provider even decides during an engagement with a patient that they do actually want them to fill something out. You can add that form for them on the fly. So we're going to do that here. As I mentioned, if you've already sent a patient a form and they haven't filled it out yet, it would already be queued up for them. So you don't have to do this step. So we've queued up whatever we want the patient to fill out. And then we'll show you what it looks like on the patient side here. So the admin would queue in the number there of the identifier that's in the chart and then be able to hand the tablet over to the patient to fill out their form. And one of the kind of positive things that we hear generally about both patient messages and reminders and tablets and things like that, is from the patient side of things, often they feel more comfortable sharing information in this way than they might in talking to the doctor, or they don't think to mention things. And so we see some really positive outcomes in terms of giving providers more robust information often to support patients, and patients feeling more comfortable sharing that information in this way versus in conversation with their doctor, which is great to see. So we're going to finish filling out that form. And then once it's all done, obviously they would be able to hand it back to the clinic staff, and the clinic staff could kind of queue up any other forms for other patients that they might like to have them complete. And then we'll just show you here what it looks like once that information is inputted into the chart. So that would all be uploaded automatically into the chart, and you can review it. It's summarized and scored for you. So it does that work for you, which is nice. And it also gives you the opportunity, if it's a piece of information that you're tracking progress, it can actually summarize that over multiple submissions over time, which is nice for some of the chronic conditions that you might be supporting. Okay, so before we open it up to questions, I thought I'd just quickly touch on our pricing for these various products. So starting with patient messaging and reminders, so that's both the one-time individual messages and those automated appointment reminder messages, that's $25 per month per provider license. So, and that would include access for one provider and a delegate, which is generally used to support, like for an admin or something like that. Online booking is an additional $25 per schedule. Usually that's per provider, but there are some examples where multiple providers might be sharing one schedule. Our website form product is $55 a month. And that was the tool that I showed you that allowed for patients to either initiate communication and or send back documents or pictures or things like that. And that one link can be shared across all the providers in a clinic. Patient tablets and check-in kiosks, again, are $55 per month per device. And then we work with a hardware provider that can support the cost of, or support with quotes for the cost of the actual hardware itself. And then finally, our Ocean Studies module is $100 per month for unlimited studies. We do generally include one free patient experience study with patient messaging and reminders, but if you have a lot of studies that you're wanting to conduct, that would be a useful tool. And I'll just highlight here also that eForm engine and that library of over 5,000 forms is available with all of our solutions. So there's no extra cost to be able to have access to those eForms. And in terms of like what eForms you're sending out to patients, you have the ability to either pull one straight from our library, which is now over like 5,000 forms, and just use it as is. You can take one from the library and customize it to meet your needs, or you can build one from scratch as well, depending on the information that you're looking to collect. And the only other thing I'll highlight here, in terms of how we structure our product, we don't charge any setup fees or implementation fees or anything like that. We also feel very strongly about only charging you for what you use. So what that means is if you activate a product and you decide to turn it off after 6 weeks, you'll only be billed for essentially 6 weeks of use. And again, you have a ton of control about turning on or off these products and using them as you'd like. We do have a support team so we have a team of practice consultants that help you get up and running when you sign up with Ocean. And we have a really great support team that supports ongoing with any questions or concerns or anything like that. And they're available 9 to 5, Monday to Friday. The last thing that I'll say about how our product is structured is you have a ton of control about, again, turning on or off these things, customizing messages that go out, appointment reminders that go out, all of that good stuff. And so with that we have a pretty robust library of like instructions to support you in that. We're obviously here if you need help, but you have the opportunity to really customize it to make it your own and to work best for you. So with that, I'll stop talking and open it up for questions. Yeah.
Thanks, Sam. If you want, I can take over the screen so that way you can take a peek at the questions. There are a lot in there. So cool. Thank you everyone for your patience as I am working through them. So maybe Sam, if you want to start off with one. So this is from Dawn. Mm-hmm. Can we have certain appointment types, auto, email, e-forms? So for example, if a patient books a mental health appointment, can it automatically send out an email with a pre-designated set of forms like a GAD-7 or a PHQ-9?
Yes, the answer is yes. So that's one of the things that's really cool about it is you can set for different type of, like mental health visit is a great example. Another popular example is, again, the well baby screens. That's probably top of mind because I have gone to a bunch of them recently, but you can automate all of that. So for those appointment types, you could have a standard template, including the forms that you want to be sent out and just automate that. So any mental health visit gets this message and you get to pick the frequency. Everybody gets that message one day before, and you can add multiple ones. You can also automate after the appointment if there's like anything that you want to have a patient do after the appointment as well.
Thank you. Sorry, a long list of these things. Okay, Wayne had a question. So this is specifically around like pharmacy stuff. So the initial question, and then I just asked for a bit more context. So will Ocean support pharmacy refill requests? So mainly like drug refill requests are currently received as a fax from pharmacies. So is there a way that these can be sent through Ocean and then accessed to sign digitally by the MD and then back to the pharmacy?
Good question. Mel, do you have any recent examples of any workflow like that? I'm just trying to think through an example.
Yeah, I would think honestly not right now. I don't think. I think like for other platforms that might be similar to something like an ePrescribe It. I think maybe in the future if it's down the line, because I think that workflow is something kind of similar to sort of e-consults or e-referrals. So I'd say yeah, maybe not just yet. But Wayne, we can always follow up with you because we can always check with our product team on that side if we have more information there. Okay. And then somebody had asked, do you have to have the online appointment show up in the impression history? Prefer it to only be in the appointment history if that's possible. I want to say not yet. I think we can probably submit this as a product request.
Yeah. That's okay. Certainly, and what I would say is one of the cool things about online appointment booking for Oscar is obviously, as I said, we're still in early access. And so the clinics that we're working with that are early adopters, we're always very, very open to feedback and opportunities to tweak the product. But especially right now, that's definitely something that's very much on our radar. So that's a great kind of question or piece of feedback and something that we can absolutely pass on to our product team.
And I think, yeah, to bolster that even a little bit more, the next question from Dawn is also, are website forms still loading as individual documents if a patient sends more than one photo, or will they group together as one entry? And do they populate in the eChart as PDFs? So I don't actually know for sure what the answer is. I'm so sorry, Dawn. We'll have to follow up with you afterwards. But I know in the past, I think you specifically had a question around this. So we did try to make some changes in terms of where the e-forms go back to. Before it was like in the chart or some people prefer documents. So it's, to Sam's point, it's exactly this type of feedback. And by using Ocean through these ways that we can understand what it is that you guys actually want and then put that into practice for you. So again, apologies, Don. I don't know off the top of my head, but we'll definitely check with product just to make sure. Okay. Oh, next one is the Ocean patient ID. So in the toolbar in the chart, different from the patient demographic ID in the EMR.
That's a good question. Mel, can I?
Sure. So yes, it is different, mainly because the patient ID kind of changes all the time. And that's just, again, for like safety purposes and stuff like that too. Like some clinics, if they have a smaller patient base, you only have like 3 digits. And then if you end up having more and more patients, you can just change that number. So that one isn't always static. And so that's why they do remain different just in case things happen. But that would be the reasoning for now, especially for tablets and other things that require that reference number. Is it possible for a completed e-form to automatically update fields in a patient's master demographics? I think if you're referring to some of like the bands on the side, I don't think we're allowed to touch those just yet. And this is similar for a lot of our other things. I think that usually the top reason is just for kind of security and safety purposes. Sometimes you may ask a patient that question, but you wouldn't necessarily want their response to automatically override anything that's already in the demographics without the physician actually reviewing it first and foremost. So that's why generally those types of questions, once they kind of come in, they'll be available for you to review as a document and then move those in. Just because, again, we don't want to overwrite any history that was already there. I don't know, Sam, if you want to add any more to that, but I think that's generally our reasoning from a development perspective.
Yeah.
Okay. Okay, Susan, sorry, I think your question I just want to read into it a little bit more because that would involve kind of primary provider restrictions and something like that. So if you're open to it, maybe we'll follow up with you afterwards.
And Susan, just to say, it's funny. I was scanning that question as well. With I've been involved with a lot of the conversations with some of the Ontario health teams as they roll out online appointment booking, and obviously supporting residents and the complexities around that is a topic of conversation that comes up a lot. The short answer is we've worked with some of our other partners that are academic practices, and there's a couple of workflow options that basically support how, and it somewhat depends on how patients are booking with the residents right now and how aware of them of like if they should be booking with a resident or their primary provider, that type of information. The short answer though, is we have a couple of different workflows that we've defined based on, again, how your clinic is booking. And we'd definitely be happy to set up some time to dive into that with you to go through exactly how you guys are booking and how we might be able to support that.
Perfect. Okay. So I'll make a note if we can follow up with Susan afterwards.
Yeah.
So Wayne had another question. So to enhance accessibility, can reminder calls be delivered in all 3 mediums? So like text, voice, and email.
So our solution at this time is either just email or email plus text. So, and you do get to customize that, whether or not basically which appointment types you want to add that text message reminder for versus just the email. I will highlight that on the e-form completion side of things, that would be done just through email. And the reason for that, Mel touched on it for other reasons, but is around security. So the communication of PHI through email is much more secure than through text message. So the text message reminders would just give you basically the information about your appointment and the ability to confirm. And then it would direct you back to your email to actually complete a form if that was included for you. And again, that's just based on security. We don't have voice at this time. Honestly, often we hear that once clinics get up and running with email or email plus text, voice is less desirable to patients. But so yeah, that's not an offering that we have at this time.
Mm-hmm. And I think, like Sam specifically mentioned, if it was on voice, the patients wouldn't be able to do things like the form. So if you were doing COVID screening, they don't necessarily have a way to easily access that. And I think some other clinics have had concerns like, okay, well, some of my older patients may not like the email or text, but that's kind of the beauty of being able to do those, because like Sam mentioned earlier, if you have a patient population that is comfortable with email and text, that now frees up your staff to be able to address maybe some of your patients that maybe just need a little bit more help there, and then you can do the phone that way, but at least all the other ones are taken care of.
Yeah, that's a really good point, Mel. That's something that is feedback that I hear a lot now. And that's interesting. It's because sometimes the perspective is like, do I want to do this? Because if not everybody can use it, is that fair? It's really interesting to hear clinics say it's actually like patients even that are not using this are happier, because now it's easier for them to get a hold of somebody over the phone, and or that your admin teams and or like the providers themselves have more time to spend, because the people that are using these automated functionalities is basically like freeing up time for the front desk team, which is nice to hear.
Okay, another question from Wayne. So will Ocean have verification features for valid health card numbers? I think this is built in for the kiosks. I may need to check with the product team for online booking, but Sam, do you know? I think for kiosks, we have health card validation.
Kiosks, yes. I don't believe at this time online booking has that, but yes, we should confirm with the product team.
Yes. Okay, another question. So for example, a consent form is automatically, okay, I'm sorry, let me read this. Oh, is it like, so whoever asked this, I'm sorry, because it says anonymous, so I'm not sure. Is it like when you're asking somebody for email consent, for example, and you want it to update in Oscar that it said that that patient has consented to email communication? If that is what you're asking for, this one I'll have to check as well. I feel like we do have that as a like a toolbar in Oscar. I know our product team is also on the line somewhere. If you want to just hop in and correct me if I'm wrong, please do so. But I know, yeah, like we used to have a toolbar. I think that if somebody did do the email consent, it would update that one. But I think it's usually just email consent is like, that's the only one that we touch. The other ones, not so much. But I'll see if anybody corrects me again from our team. Okay, another question. Can the online booking screen be customized so that the patient selects the reason for appointment first before selecting the type? So like in person or virtual?
Yes. Yeah, that's a great example of how I was chatting about really you get to layer on as many kind of forms and or questions as you'd like. And you can do exactly that. Like you can make it so, for example, if somebody clicks prescription renewal, you can make it so that only can be done virtually, and or vice versa, like something that needs to be in person. You could basically make it so like if you clicked on, I don't know, well baby appointment and somebody tried to click virtual, it says like has to be in person. So you get to kind of direct them in that way.
Perfect. Okay, I keep forgetting to say that I answered those ones live. Sorry, let me just go back through the queue. Okay, maybe next, let me just go through some of the questions that we've already answered. Oh, actually, you know what? Maybe do this one and then I'll go through.
Sure.
Since the appointment system is linked to our EMR, is there concern about cybersecurity, worry that this may open more potential vulnerability?
It's a great question, and it's understandable to have that concern. What I'll say is our solution has, our product team rather, has spent a ton of time basically ensuring that that information is safe and is protected. One thing that I'll highlight is we don't have access to any PHI. So think of Ocean is kind of like a middleman between your EMR and obviously any information. So information doesn't stay in Ocean any longer than it needs to. And no one other than you has access to that PHI. So when you're setting up your Ocean site, you set up an encryption key that protects any of this PHI. So no one at Ocean or anywhere else really has access to any of that information.
Mm-hmm. And from just like an overall perspective, we routinely do things like threat risk assessments and privacy impact assessments and things like that as well. So obviously just being in the healthcare field, cybersecurity is of the utmost importance to us. And actually, we just had a lunch and learn the other day that was provided by our VP of research and development, talking about this exact thing. So because of that, and again, feedback that we've heard in the past, we've implemented different things like virus scanning as well. So there's different aspects that we do obviously want to protect you from. So that's why we've added those types of things. But overall, from a cyber and security perspective, we do a lot of work there. And if you are interested in reading into any of that, we do publish that in a section in our support portal for security, privacy, and encryption. So we're more than happy to link that to you if you want to do some additional reading. There was a question that we answered over the chat, but I think might be worthwhile kind of mentioning overall. Somebody asked, are other clinics using the reminder process to remind/book patients for things like preventative screens, like cancer screening, PAPs, et cetera?
Again, yes. Short answer is yes. That's a great kind of use case, and where you can use our product that again can help support that is with that cohort messaging. So you could do a search for any kind of category of patients and then send them out a standard message to remind them for something like a PAP and or a mammogram, anything like that. That's actually a great use case.
Mm-hmm. And then this one, I don't know if it's like as relevant given that the time between screens is quite long, but as Sam mentioned earlier for the reminder demo, you can set it so that reminders send after the appointment. So if you happen to book them for something initially, I don't know if you would, but you could set a reminder for like 3 years after. And so then at that point, something like that goes out if you want to really automate that. But I would say, most commonly is the cohort kind of group running a search in your EMR. Okay, so we have another one. Are the email cohorts still limited to 100 at a time?
Yes. So, and great question. And that comes up a lot. Really, we designed that cohort messaging functionality to be somewhat directed and focus kind of more on PHI. Then obviously also clinics have like blasts that they might want to send out about like clinic policies and or things like that you would just want to send to everyone. So our solution really isn't designed to support that type of communication at the time. It would just be the 100 patients, but we do hear clinics, there's some kind of free options that are out there that support that kind of messaging everybody in your EMR functionality.
Yeah, I've had a lot of clinics, they say like MailChimp is great because I think even as a free solution, you could do up to 2,000. So for things just like basic kind of maybe clinic hours changing or things like that, those ones become kind of good options. But yeah, like Sam mentioned, for kind of smaller, more targeted, especially in relation to PHI, it's 100. Technically, you can go above if you're using your own domain, but at that point, it opens it up and it becomes kind of like a regular email. So you can kind of weigh out the pros and cons if you want to do that. But I would say overall as well, I hope I'm not speaking out of turn here, but I believe our product team is focusing on just making changes to the messaging product as a whole this year. And so I think the cohort message, I know, during COVID has been a huge thing that people kind of rely on. So we're looking at that overall and seeing where we can make changes for people. So Dawn, feel free to submit your feedback for that as always. Okay. And then I think this one maybe is for referrals. So we had an issue with SJH. I want to assume St. Joe's. Yeah, maybe St. Joe's, where there was no response to our eReferrals after several days. And we only found out after issues on their end after calling them multiple times. Is there a place that receivers can post their downtime so senders would know? Or is there an alternative to the clinics having to call?
That's a very good question. And so I would say probably the best place to direct that question would be to the eServices team, because they're the ones that kind of oversee the program and define and tweak any processes like that. So we can kind of connect you with the right person at the eServices team to look into what that issue might have been caused by. I see it's anonymous. Yeah, so I think it would be the eServices team would probably be able to dig into that and give you any recommendations of where else they might be able to reach out.
Mm-hmm. But this is interesting. I think, maybe we can take this back to the product team because I'm like, something like that could easily be well, I mean, again, naive, not a developer, I don't know. But just like in the directory as like a flag if a listing is down or something like that.
Yeah. Yeah.
Okay. Perfect. Okay, so I know we only have 2 minutes left, and again, super, super thankful for all of your very engaging questions and great insight into everything. So if anybody does have any last minute questions, please feel free to kind of just pop them in. Alternatively, if you do have any questions afterwards, you can definitely reach out to Sam and her lovely team. So by going to the link on this page, and I believe this webinar will be sent out afterwards if you need this as well, but you can always go to this link and just get in touch. I know Sam is personally looking through all of the submissions there. So if you want to get in touch with us, please, by all means, we welcome your questions and anything like that. So I don't know, Sam, if you want to have any last words.
Yeah, no, thanks. Thanks so much for having us, guys. And thanks for, some really great questions. And looking forward to continuing to chat with all of you. Again, lots of names that I recognize there, which is nice.
Awesome. Okay. Thank you so much, everyone. Enjoy the rest of your day, and hopefully we speak to you again soon.